Hi, my name is Shauna McEachern. I am the Regional Knowledge Exchange Lead for East Region with CAMH, Center for Addiction and Mental Health. Hello.
Hi, I'm Kim Baker and I'm the Regional Implementation Coordinator for the Waterloo-Wellington Service Collaborative.
Hi, I'm Jim Madden. I'm the Regional Evaluation Coordinator for the West Region, and I support London, Waterloo-Wellington, and the Hamilton Service Collaboratives.
Hi, my name is Chantal Wade. I'm a program consultant at CAMH. I'm the Health Promotion Prevention Lead for East Region.
I'm Sharon Labonte Jakes, and I'm the Regional Manager of the West Region Implementation Team.
As a Regional Implementation Coordinator, I act as a local project manager for the service collaborative that I'm assigned to.
So my role is to support the implementation of the service collaborative in Ottawa.
And I help to ensure that the service collaborative attains the key milestones through using the tools and processes that we've put in place as the SISC project.
To do that, I have a number of different functions. I link with the regional implementation team here at CAMH in Ottawa, and I also link with the CAMH team in Toronto.
I also work very closely and collaboratively with other members of the regional implementation team, like Knowledge Exchange and the coach, to ensure that sort of all of the moving parts are coming together.
What the coach ends up doing is helping to operationally or functionally define what the intervention is going to be to address the gap. Looking at everything from the drivers who are going to be involved, what's the admin support, what's the HR support, what IT support might be involved, and what can be expected of frontline staff as they implement the intervention.
My role as the regional manager is to be the connection piece between what happens at the local level and make sure that fits with the provincial goals in the project. All these local activities add up together to be the provincial project, and it's really important that there's a synergy and similarities between the two. That's what will make it successful.
The implementation of the service collaboratives is a unique process, I think, from start to finish. And within that unique process, there's also unique pieces that are coming out, and I think that are very particular from collaborative to collaborative. So they're really exciting to see.
Going into this process, there was a real commitment to engaging stakeholders from all the different sectors, as well as service users, as well as families.
We're really wanting to engage meaningfully with our priority population as identified locally. For us in Ottawa, it is with our Francophone population and Aboriginal, or I should say First Nation, Métis and Inuit people.
We have representation from addictions, mental health, youth justice, education.
Le travail du service collaboratif sera fort important pour nos populations prioritaires, dont une de nos populations prioritaires pour Ottawa sont les francophones.
I've worked in public health for about 12 years and I've done some other community-based work. I'm not aware of an effort where there's been such a thoughtful, deliberate, strategic approach to try to identify systemic problems across sectors and try to create system-level change.
The Service Collaborative in Ottawa, I think, is going to have a lasting impact in our community. And one of the main reasons I think that is because we're building on the great partnerships, the great skill set, and the really determined organizations that are already here and have this spirit of working together.
I think that the service collaborative is going to impact the community through capacity building in terms of implementation science as a framework for future system change. So this gives the community information, knowledge, and resources that they didn't have before to look at system change in a different way.
We're really seeing a movement towards community ownership of this as we move into implementation and partial implementation, and I think that that spirit will always be retained, that people feel that they have put themselves into this.
You know, we've been very systematic and thoughtful, bringing evidence to bear, good research to identify specific gaps, specific problems, and then bringing good evidence-based practice to try to address those problems.
You're also changing how families are experiencing that sector. I think there's that piece around, resiliency or self-advocacy that's really sort of played itself out in terms of our intervention. And I think that that's the hope, is that agencies work differently together, but families start viewing themselves as having, that built-in resiliency, the skill set within themselves, and they understand and can work within that sector differently than they have before. And I think that's the hope that I sort of take from it.
What we strive for is improving the health, well-being, happiness of children, youth, and families in Ottawa.
I think something that I've learned about the mental health and addiction system in Ontario since we've started the collaborative work is really how much it's founded on people that are really dedicated to system change.
I think the one thing that has really come to light for me about the system is that it is bigger than I thought it was. The system, traditionally, I thought of, Ministry of Health funded addictions and mental health partners, but the system is really so much bigger than that.
It's quite a humbling experience to have executive directors and other people involved in the system who we all know have very busy schedules, take time, and quite a bit of time invested in this project. Coming to meetings, doing work outside the meetings, all on top of everything else that they do. It's a real gift to the community that they bring.
People from different ministries, different sectors, who have been focusing on addictions and mental health for a really long time and maybe haven't had the opportunity to contribute to some of the system change conversations in the past.
There was in Ottawa unofficially a lot of collaboration happening across sectors, but not formally. So which meant it was always based on the people that you knew inside of the other sectors, but we need to really bring that up and make it a way that we worked every day. And having not just the contact in the person, but creating the pathways that are there officially, creating the protocols that spells out how to do this across sectors.
That this is really about kids and about kids and their families. And yes, we may have some challenges and some successes some days, but I always go back to the fact that what we're doing for families and we're doing for kids, and everybody involved all has that same goal. We want to make Ontario a better place for young people to live.
We need to engage with health, we need to engage with addiction, with mental health, with justice, so everything comes into play nicely, but it's a way to make everything official, recognizing the benefit of doing it and creating the road, the pathways, the protocol in order to make this business as usual.